websites like the Public Health Agency of Canada and the World Health Organization. I know that self-isolation is difficult, but it is required for everyone's health and safety. We must all do our part to support those who may be in self-isolation. For anyone who may be having issues or concerns with self-isolation, the Canadian Red Cross COVID-19 helpline is available to you. The number is 1-800-863-6582. The service is available 8 a.m. to 8 p.m. daily, and this information is also available on our website. To summarize, we now have 20 new cases and a total number of 102 cases in this province. By health region, we have 95 cases in Eastern, 2 in Central, 1 in Western, and 4 in Labrador-Grenville Health. I want to thank everyone who has been doing their part to help reduce the spread of COVID-19 in our province by staying in unless essential, practicing physical distancing, washing your hands frequently and well, and staying home if you are sick. We all have a role to play to flatten the curve. How we behave now will determine how COVID-19 will progress in our province. Thank you.
Thank you, Dr. Fitzgerald. Well, it's been a difficult couple of weeks for your province. We're facing something that we have never experienced before. Your daily routines, well, they've been turned upside down. But as we head into the weekend, I know that people would want to burn some of that stress and experience a sense of normalcy in their life. We want to spend some time with your family and friends. But we just need to impact those around us. As Dr. Fitzgerald said, we must always keep social and physical distancing paramount in all the things that we do. 6 feet apart is what we mean when we say that. Today, as you've noticed, the federal government announced additional supports for our provinces and our people that are impacted by COVID-19. A wage subsidy for businesses who qualify up to 75% of wages for your qualifying companies. The Canada Emergency Business Account, where banks can offer up to $40,000 in loans and $10,000 of that forgivable. An additional $12.5 billion to help small and medium-sized businesses. Also, the opportunity to defer HST and GST payments until the end of June. This is in place. These measures are put in place by the federal government to help the business community employees get through these difficult times that we're experiencing across the country. Now, yesterday, as you know, in Newfoundland and Labrador, we opened up the legislation for an urgent setting, something that has never been done before. It was an important day for us as we set aside our political partisanship, and we had a group yesterday in the House of Assembly, a small group, that did a tremendous amount of work addressing the priorities for Newfoundlanders and Labradorians, the social and economic well-being that impacts you in your life. We put in place measures for employee protections to protect tenants in rental properties if they have difficulty meeting their monthly rent. We also put in place a bill yesterday of interim supply, and that is really giving your province the ability to keep the finances going until September of this year in case the House is disrupted until June. We also put in place a number of restrictions for your safety around ferry crossings, limiting passengers. The captain now has a discretion. If you want to stay in your car, you can, but that would be on the discretion of the ferry captain. Marine Atlantic today has put in some extra measures as well to protect you and the safety of passengers coming across the Gulf into Newfoundland and Labrador. Also this week, we announced free childcare, and this is really a call for action, working with our regulated childcare operators to support our essential workers, those essential workers who have difficulty in finding childcare services for their children as they go on the front line to protect Newfoundlanders and Labradorians. Of course, all of this would need to be done in the safest way possible. Businesses and contractors who have existing contracts with government, you will continue to get your contracts as they were written and as they were put in place. So we're asking you to pay your employees. We are paying you, so we are asking you to pay them. We have also put some measures in place for those people that are returning from the province. We know we have numbers, great numbers of snowbirds that are returning from what was a sunnier climate, coming back into Canada. So if you're coming from an international travel, and you're asymptomatic, if you're coming to an airport, and you do continue home to Newfoundland and Labrador, the message is very clear. 14 days in self-isolation. When you return to our province, no exception, is 14 days of self-isolation. You're coming from a country that is leading the world now impacted by COVID-19. The prevalence rate in the U.S. is about 2.5% of what it is in Canada. So it's important now that you protect yourself and protect others, your family members. I know many of them, they would want to be able to get close to you, give you a hug, but keep the relationship like you've had it going for you when you're weeks and months away from your province. Keep that relationship, do self-isolation so you protect us and you protect your family. Today we've been receiving a number of questions about some of the unsung heroes in our province, like our truckers. Today we've had discussions with companies like Irving, Marine Atlantic, and the Salvation Army, who's been there in so many disasters and so many crises in Newfoundland and Labrador. And they are stepping up to provide just facilities that you require as the trucking industry, those unsung heroes, as you bring in the essential goods and services to Newfoundland and Labrador. And I want to just mention just an example of people are coming together, like Eddie's Restaurant in Southbrook. I had a conversation, and the staff member, with such enthusiasm, she said, "This is Eddie's Restaurant." Her name was Debbie, and she quickly put me on to the manager, who was Wallace. And Wallace came on, and like all Newfoundlanders do, they were ready to step up and help the trucking industry in giving them a warm meal, giving them a place to stop so they can just get refreshed as they continue their journey to bring the goods and services into Newfoundlanders and Labradorians. I also want to know that there's people out there worried about April 1st, given the impact of Canada Post and the disruption of your mail service. We have some 1,700 checks that are ready to go to income support, and we're working on a plan now to get those checks in your hands by April the 1st. Also those that are expecting support enforcement payments and so on. If there's a check coming to you as of April the 1st, you will get that at the postal outlet or a plan that we will determine a place where you can receive your checks. So we take our advice from the Chief Medical Officer. I want to know that there are many team sports and so on, social events, but you must remember that if you want to play in a team sport that is close play, you have to keep social distancing. So we ask you to avoid those things for your own protection. Keep that physical distance no matter what you do in your life. More than ever, we need to work with one another. This is a lonely and a stressful time, as Dr. Fitzgerald just said. This is a stressful time for many in our communities. And I will tell you, it was refreshing to see from a video from Skype and FaceTime Live from a group in a St. Anthony Senior Zone that were sharing a video with the families of people that could not visit the home because of this stressful time in our province. But we know this is happening in many personal care homes and long-term care homes across our province. So we encourage you to socialize, but socialize in a very different way. Keep that physical distance between you and your loved ones. This going into the weekend, I know many of you would, in the past, would be on a Sunday. You'll be going to a church services. But those church services now, those areas of worship can be done in very different ways. And I thank the many organizations across our province that are connecting with their parishioners in a very different way, very unusual, something that we've been not accustomed to in Newfoundland and Labrador. But I know thousands of people will be going to church this Sunday in a very different way. Every bit of social contact that you make, you can feel connected. But we must remember that this is a very stressful time on families. Keep that physical distance so that you can limit the spread of this virus. Now, since March the 18th, your province has been in a state of emergency, a public health state of emergency. This will remain in effect. And we will continue to work with you and your colleagues, work with the federal government to make sure that we take the strictest measures possible to prevent the spread of COVID-19. Our job is to protect and to support you as best we can. Once again, if you're not compliant, we will take whatever measures are necessary to deal with the spread of COVID-19. We know this is impacting families and friends. We know now that this is spreading around Newfoundland and Labrador as we've reached Now 102 people confirmed positive within our province. If you have questions around COVID-19, we ask you to visit the website, do the self-assessment tool, check out the 811 website. There's a lot of information related to the thousands of questions that are coming into our departments. Go to that website. We have the information there. And once again, as Dr. Fitzgerald said, we've put up the Red Cross helpline. That number is put in place for those of you that are in self-isolation. You could be a visitor. You could be a resident. Call that number if you have questions. One more time, that number is 1-800-863-6582. As been said already, the actions that we take today, every one of us in Newfoundland and Labrador, will determine our future tomorrow. The Chief Medical Officer is right when she says the time is now, but we can do this together. Let's be responsible. Let's take control of this virus so it doesn't take control of us. Thank you. Now, Dr. Haggie is on the line, and so Dr. Haggie, did you have a few comments this afternoon?
Thank you very much, Premier. Yes. I'd like to pick up on some of the comments that Dr. Fitzgerald had made. We've seen yet again another day where we've had new cases, and I think that speaks to the importance of not being complacent. We've seen someone, unfortunately, have to be hospitalized as a result of progression of the illness at home and require facilities of an acute care hospital. People need to stay home. If you have symptoms, you should not be going out and about at all, and you should use, as people have said, a self-assessment tool to try and determine whether or not further action needs to be taken, and if so, what. We've talked a lot about physical distancing, and we've encouraged people to stay socially connected. The weekend is coming, and there's a great tendency for people to go to sheds. I saw on my drive home yesterday lots of vehicles clumped together with people on snowmobiles. It's a shame if you socially distance yourself at home only to undo that good work by running risks with a whole different group of the boys in the woods. Warm-up shacks on the trailway are not really the place to be this weekend. Of the people who have been affected in the St. John's and the metro area, 75% of them have come from one particular location over a course of a 3-day period. And this mirrors the kinds of things that we've seen in other jurisdictions. And Public Health are working through that, and their investigations continue. One of the fallout from that has been healthcare workers who have contracted the virus at that location, and there has been some concerns that some of this might have impacted their co-workers, particularly in facilities in St. John's. That has resulted in some changes on those units and staff being sent home for self-isolation. We have, through forward planning, been able to reduce, however, the number of inpatients across the hospital and acute care beds by nearly half over the course of the last 10 days by acting promptly to reduce bed use by cancelling elective surgeries. We know this is inconvenient. We know this is a cause of concern for some patients, but it has been a necessary lever to allow us the flexibility for the system to deal with a potential surge of patients with COVID-19 who require admission. For those people who do feel ill and feel the need for attending a facility or calling 911, it is imperative that you tell the people you speak to at the first opportunity and keep repeating it if it's likely you've been exposed to COVID-19 or if you have traveled abroad. Our site for information, trusted information, is our government website, and it directs some through to 811. Our 811 line is there also for people who are not ill necessarily because of COVID-19, and I would encourage those people who need it to continue to use it. There have been some challenges with resources. The important thing to realize is that once you dial 811, you should stay on the line. There have been some long waits, and, people have actually gone and put on the laundry and come back with their speakerphone waiting to be answered. Now, however, because of resource changes over the course of this week, we've put extra people there in large numbers and put in extra phone lines. The wait at certain times of the day is down to minutes. 811 tell me that every time I go on the air at 2:30 in the afternoon, they get a spike of calls immediately afterwards, so I think they're dreading these events. You will get through. There are now only 96 individuals waiting for a call back, having been triaged by 811. The maximum wait for these people now to be contacted by an RN is now down to 9 hours. That sounds like a long time, but this is a huge improvement, and I really must thank the staff at 811 for their sterling efforts in dealing with what has been a very challenging demand. We are looking at new ways of trying to provide assessment tools. We know that the era of Skype and Facebook and Zoom is with us now, and that makes connecting easier. We're looking to use those technologies to help bring the information you need right to you, and we'll hopefully have some announcements around kinds of things like that over the course of the next little while. But again, stay home, keep your distance. If you're not well, for heaven's sake, don't go to work. We can do this, but the time to get this right is now. And so with that, Premier, thank you very much for the opportunity, and I'll pass the microphone back to you.
Thank you, Minister Haggie, and we will now open it up for questions.
For the benefit of our speakers, we have 8 reporters registered for today's call. In the essence of time, each reporter will be given the opportunity to ask 2 questions and 1 follow-up. We will run through the telephone queue, so each reporter is given an opportunity. Following this, should time permit, I will ask if there are any further questions. This call will end at 3:29 p.m., and further questions can be emailed. Operator, please proceed.
Thank you. The first question is from Peter Cowan from CBC. Please go ahead.
Dr. Haggie, you said earlier this week that we should treat everyone, including our neighbors, like they have COVID. Why aren't paramedics and healthcare professionals doing the same?
Paramedics and healthcare professionals have a series of protocols to help them manage individuals who they go to treat. Certainly from the point of view of paramedicine, one of the things I have to emphasize, and has not always happened, is that paramedics are going to calls from people who actually know that they have been exposed potentially to COVID or have traveled abroad and have not actually revealed this to dispatch. So the paramedics arrive unprepared. Each frontline ambulance has a PPE kit, and those kits can be replenished as they are used. But if people will not be honest for fear that they are somehow going to get a lesser standard of care or people will not come, then I can reassure them now quite clearly and categorically that if you need an ambulance, it will come, whether or not you have been abroad, whether or not you think you have COVID-19 or not. That is irrelevant, but it is important that the staff know so they can protect themselves.
This week we've had snow, torrential rain, I think 100-kilometer-an-hour winds. What are the plans to provide testing in bad weather? Because that's not very conducive to the drive-through testing centers that have been set up so far.
No, there are alternatives to the drive-through testing centers. If you remember, we were running on an in-home or home visit kind of affair, and certainly in Labrador, drive-through has not been introduced. The RHAs do have alternates. Each of the people who need testing is contacted directly, and if there is an issue with weather, then those instructions will change depending on the weather.
Premier, I'm wondering if you could give us an update. How many people in this province have now lost their jobs because of COVID-19?
The number of people that would have lost their jobs, we'll see the unemployment numbers usually around early April again, but we know there is a significant number of businesses that have made changes. Some businesses have decided to keep those employees on the payroll, so that would not show up in the unemployment numbers. Today's announcement, I think, from the federal government will help with that. I mean, because right now, the business owners, small, medium-sized businesses and others, when you look at a 75% wage subsidy, that will allow them to stay connected to their employees. In actual fact, they really do not have to lay their employees off. They can just keep them, and the employee under the announcement that we're seeing today, details will come out more in the next few days, but they could potentially see a 75% wage subsidy. So one of the reasons behind all of this is some key employees and employees in general that if the employer wants to stay connected, this gives them an opportunity to stay connected to those employees.
The next question is from Patrick Butler from Radio Canada. Please go ahead.
Hi there. The first thing I want to ask about is when we see this first case in a hospital in the province, how does that change setup and equipment at our hospital facilities?
That's a good question. Each of the RHAs has a plan based on protocols, and the plan has been based around the idea that there would be specific places within the RHA facility that would be treated like isolation wards. This was common practice at one time in infectious diseases hospitals, and these changes were expected over the course of the country, according to data I received today from the FPT telephone call of health ministers. The admission rate for COVID-19 is around 6 to 7% of those people infected. So given the numbers we've got, we would actually expect to have a couple more admissions at least by this stage, as we have 102 people currently testing positive. These plans have been in existence for some time. They involve adequate preparation, PPE training, and this kind of thing. And we have had the plan existed, and it's been refreshed, and people have had a 2-week lead time to get ready for it.
I don't think I heard anyone mention anything about whether any of these patients have recovered yet. Could you confirm that nobody's recovered? And can you talk a little bit about the amount of time it's expected for somebody who does get this virus to be able to recover?
So we have one person who meets the criteria for recovered in the province, and for most people it's a mild disease, and so they're feeling better usually within a week or so. But if it's more severe disease, more complicated, or if there's underlying medical conditions, it certainly may take longer than that. And for people who are admitted to ICUs, of course, there could be other things that are happening, so it could be quite a long time for their recovery.
And the last thing I want to ask, why hasn't the province released things like flight numbers, flight details of travelers to the province who turned out to have COVID-19? We've seen at least one province, Prince Edward Island, do this. Why did Newfoundland choose not to?
On the advice of the federal government, it appeared that when they went through the process of contact tracing on aeroplanes for the medium and long-haul jets, the pickup rate for those people who didn't develop symptoms was so low that in actual fact PHAC stopped recommending testing routinely people who had been on the same flight. The key there was symptoms. And it would appear that it's related to the fact that on these medium and long-haul jets, their air conditioning system uses filters that are the same design and brands that are used in the National Microbiological Lab. And this is felt to have some bearing on it. So the facts of the case are we have been guided very much by evidence, and the evidence is that that produced no benefit.
Thank you.
Thank you. The next question is from Kellyanne Roberts from NTD News. Please go ahead.
Thank you. Some crisis centers are getting an increase in calls from women. Domestic abuse spikes during pandemic, people often trapped at home with their abusers during a stressful time. What work is government doing to offset these violent consequences for women and girls?
Just a few days ago, and we've mentioned this, I think, in the early days about the anticipated, given the stressful situation that many families are living under, that unfortunately this is something that, that happens in society. So just a few days ago, we once again announced the funding, a large amount of funding for community-based organizations, and many of those violence centers, the status of women's centers and so on, would be people that would, these organizations would be the types of groups that could access this kind of money. Also, we want to continue to work with those organizations, realizing the stress that families are under, and the violence is not acceptable in any form, and we will continue to reach out and support wherever possible to reach those families and those, in particular, women that are in stress and in time of need.
Thank you for that answer. With our first admission now of a patient with COVID to hospital, people that are coming into hospitals, although it is restricted, there still are patients and visitors. How come they're not being given any masks or gloves upon arrival?
That's a good question. The hospitals and the RHAs advise me that they are now down to one access point per building, per facility. They have security there and they have screening in place. In general, the use of masks is best reserved for those people who are actually infected. The other piece of that is that we have limited visiting severely across the RHA facilities. You cannot now visit at all in long-term care, and in the acute care facilities, by and large, visiting is restricted very clearly to end-of-life, children, and the case room. So there is a much reduced number of people going through. Obviously, there will be people who will have to access clinics, but again, they're screened, and that is done for urgent and non-routine patients only, as all routine activities have ceased.
And a follow-up, we're hearing many people saying that St. Luke's Retirement Home has had a case outbreak there. With places like Paul's Funeral Home and the outbreak we've seen there, they posted publicly that there had been exposure. Should other places be taking this initiative as well?
I think if there has been a possibility of exposure, certainly residents should be aware of that. In terms of a long-term care facility, my information is that the person who subsequently tested positive did not work while symptomatic and acquired the virus at calls.
But so should businesses post if they have an outbreak at a business?
I think that's up to the individual business. If you look at what the orders are that Dr. Fitzgerald has issued, there are very, very few businesses that are still staffed in the way they used to be and having forward-facing or public-facing access. Most businesses who should be working from home. And you've seen through Service NL and Minister Gammon Walsh's department a closure and reduction in counter service. We would expect that private businesses should do that and exercise the precautions that people have recommended, such as Dr. Fitzgerald, if their business is regarded as important or essential and permitted to work.
Thank you.
Thank you. The next question is from Elizabeth Witten from the All Newfoundland Labrador. Please go ahead.
Hi there. I heard a rumor that there had been 3 confirmed cases at Portage Place, and I was hoping to hear if that was confirmed or denied, and if so, has other people in that facility been tested?
My understanding is that there are a variety of potential sites in Eastern Health where workers who go there have tested positive. What needs to be done as a consequence of that is very much an issue for public health and contact tracing, because it's not at all clear in every case that these people have actually worked while symptomatic. So the risk could actually be negligible. In those instances where they have, then public health will be in a position to advise those other co-workers and the building managers as to what the appropriate course of action should be.
All right. And as a follow-up, we know that there are a number of cases now that are senior citizens who are most vulnerable to COVID-19. So are there any, besides self-isolating and being followed by public health, is there anything else being done to monitor them perhaps more closely?
You raised a very good question. One of the things that we have done is to institute virtual care for primary care providers. We currently have 288 primary care providers registered, and I would encourage the primary care provider and the individual concerned to use those kind of services to access primary care from the comfort of their own home by telephone or by Skype or whatever platform the provider chooses to use. We do have recommended software through NLCHI for those providers who haven't made a choice, and we're fully prepared and fully equipped to support the installation of that at no cost to the provider. So there are other options there, and again, I would encourage people to think about the appropriate use of 811 if you are unwell. But the secret is, if you need help, ask for it.
Thank you.
Thank you. The next question is from Peter Jackson from The Telegram. Please go ahead.
Hi, there's been a big uproar in the States in particular about a drug called hydroxychloroquine. And there have been two contradictory tests on this. I'm wondering, is this the kind of thing that you feel might actually hold hope? Or is it just another craze that that needs to be squashed?
You have two people here with degrees who could fight over that. I can go first. This is an unproven drug. It's not traditionally used for this kind of thing. It has some theoretical merit and certainly is being trialed. As with any drug trial, it will be prone to the usual problems of a non-randomized drug trial. So it's a question of keeping an open mind. If it looks promising, I'm sure our clinicians will be interested in it. And if in the fullness of time it doesn't, then that will become apparent too. I don't know if Dr. Fitzgerald would like to shed any more comment on that, but it's a respirology/ICU kind of specialty.
Yes, no, I agree, Minister. That's exactly right.
I can say from someone who spent 33 years as a pharmacist and filled over 1 million prescriptions, I've never filled a prescription for hydroxychloroquine for a virus.
No, I've never written one for a virus.
Okay, thank you. Follow-up question. You have another case in Labrador Grenfell. Is that, do you know if that's related to recent ferry incident, or was that related to the travel case?
No, this is a separate incident. It is related to travel, it seems, but not related to the ferry.
Okay, and I have one other follow-up regarding precautions. There are a lot of cashiers and that sort of thing now who are sort of in close contact, but more importantly, handling products, for example, at grocery stores. A lot of them are wearing latex gloves, and there's evidence to suggest that those gloves, if it's worn constantly, might actually be more harm than good. What is your advice to people working in that kind of situation?
So latex gloves can protect you, but nothing will protect you if you don't wash your hands. So if you have those gloves on, you are still touching many things. One of the other things you worry about is when you take those gloves off, you can actually contaminate your hands with what's on the outside of the gloves. So you have to make sure when you take the gloves off that you wash your hands well or use an alcohol-based hand sanitizer to disinfect your hands. There is concern that it may give a false sense of security. And of course, people still touch their face when they have gloves on. All of the rules that we've been saying before about washing your hands carefully, don't touch your face, that all still applies even if you're wearing gloves.
Thank you.
Thank you. The next question is from Drew Brown from The Independent. Please go ahead.
Hi. So I'm wondering if the province has any expectation around when the sort of first major spike in cases will show up. We've seen a few, obviously, from last week that are now showing up this week from the Coles incident. Do you know when we might expect something more general?
We have been involved, Drew, with a lot of modeling through Health Canada. It's early days yet because our curve has only just really begun to develop. But that's something that at the federal and national level we are keen to try and do. We were discussing that on a call actually just at lunchtime today with my colleagues across the country. I don't have a crystal ball, and I don't know whether Dr. Fitzgerald's shop yet has enough data to make any firm prognostications, but it's certainly something on our radar, and I might pass that over to Dr. Fitzgerald.
No, exactly, Minister. We certainly are looking at that. And it is very early days. Obviously, we've had a little spike with this cluster of cases, but this is very much, most of these cases that we're finding are related, can be related back to this funeral home situation. But we hope to have some information in the near future that will help to guide us, and hopefully we won't see any spikes.
Perfect. Thank you. So, do we have adequate bed capacity for COVID-19 patients across the province?
We have worked really hard. If you recall, nearly 2 weeks ago now, we cancelled all elective diagnostic and surgical procedures. And as a result of that now, our bed occupancy is down to around the 50-55% mark. So that leaves us all those other beds, the 45%, free and staffed, ready to take COVID-19 patients should they arise. The current data from Public Health Agency of Canada as of this morning is a 6 to 7% hospitalization rate. This is actually lower in Canada than in China, where they were running at one stage at 15%. So certainly we have significant bed capacity and staff capacity currently. We also have just around 40% of our ICU beds empty. And we're only using 13% of our ventilators. So we do have slack we hope we'll never have to use.
Perfect. Thanks. And yeah, so in addition to sort of canceling elective surgeries and such to reduce the beds, are there sort of any anticipated measures that might be brought in, like outpatient services being canceled?
Well, in actual fact, outpatient services that are delivered in RHA facilities are actually been reduced, and we have asked practitioners to go to emergencies or urgent only. That's a matter of judgment, and we've left it very much in the hands of the individual practitioners to decide what may or may not constitute an emergency. Family practitioners, nurse practitioners know their patients very well, and we've also now opened up the opportunity of virtual care by phone or by video, so that the frequency of face-to-face interactions has dropped. What we have done in terms of capacity, other than beds, and we've looked at alternatives as well in terms of maybe able to move some patients out into maybe even long-term care facilities or other facilities we would not typically use. But also we've looked at trying to increase our staffing complement. So, for example, today, I think in the Gazette you'll see published new regulations that authorize the College of Physicians and Surgeons, the College of Registered Nurses, for example, to grant emergency licenses to groups of practitioners who would not otherwise have been eligible simply by virtue of the fact they retired last year. That was never envisaged in their regulations, and we fill that gap. So we have a pool of potential pool of retired skilled, experienced personnel who could be drafted back at short notice.
Perfect. Thank you.
Thank you. The next question is from Holly Mackenzie-Sutter from the Canadian Press. Please go ahead.
Hello. This week we saw the first person, I guess, arrested and brought into custody for breaking the public health emergency orders. But at the same time, we're seeing people released early from jail to prevent the spread. So I guess, can you explain how jailing people as a public health measure kind of reconciles with general best practices for slowing the spread of this disease?
Jailing people for medical problems has never been terribly popular or useful over the years. Unfortunately, in this situation, we have to recognize that there is an element of public safety. I can't speak directly to the issues from Justice and Public Safety, but my understanding is that they have gone through a very thorough process to determine which of the inmates can be let out under specific community-based conditions. I suppose the nearest analogy is we have gone for early discharge from hospital for some patients with adequate supports in the community, and that, from my health perspective, would be the nearest analogy I could draw. But if you want any more detail about specific programs from Justice, I would suggest you email those questions and we can pass them along to Minister Parsons.
Yeah, and Holly, jailing people is not our preferred option. We said this many times. The preferred option is to prevent it. But if we get people that abuse and disregard the guidelines that we put in place, well, there will be a course of action. It could be fines, as we said earlier this week, taking away driver's license. I think people need to take this seriously. The guidelines have been put in place through a lot of consideration by the chief medical officer that people need to take them serious. So it's not the preferred option to be apprehending people, but it is our option if we need to. And so it's important for us to get the message out to those individuals that fail to comply, that if needed, we will take the correct course of action.
Hey, thank you. And just as a second question for Dr. Fitzgerald, I just wanted to confirm that all 102 of these are now confirmed cases, even presumptive cases that were sent to Winnipeg before the province had the ability to confirm?
Yes, that's right.
Operator, do we have any further questions?
Thank you. The next question is from Allison King from VOCM News. Please go ahead.
Hi, I was wondering firstly if you could let us know where the single patient in hospital is located.
It's in the Eastern Health Region.
All right. A follow-up to that, if a child develops symptoms for COVID-19 and requires hospitalization, what is the protocol there? Can parents stay in isolation with the child?
That would be the physical location would be determined on clinical need. So the issue would depend on where the individual was. There is always an option if a child is ill enough that they could be sent to the Janeway Hospital. The issue around contagious or infectious diseases and parental company is always a very emotional one and a difficult one, but it's one for which there are protocols, and obviously the desire to have close contact with mum and dad when child is in hospital really has to be tempered with the safety element of that. But there are protocols in place to allow parental visits and parental company, but it's done under a slightly different way. It involves the use of PPE and these kinds of things. But again, it's an emotional subject, and we would never deliberately separate children from their parents under these circumstances.
Thank you. And for Premier Dwight, will the province be considering regional travel bans to keep people from moving about the province and potentially spreading COVID-19 to other communities?
That is not something that we are considering right now. We take this advice, of course, working with the chief medical officer. Although we've seen, I think, some provinces like BC that have had to deal with this within communities, and even there in BC, where these were where COVID-19 were some of the early days. For Canadians, and even there, that province has yet to put in travel bans between communities. For us in Newfoundland and Labrador, what we've been able to do is restrict travel from out of province and restrict international travel, and that would require a 14-day self-isolation. As you would expect, many of the services, even essential services that people would require as they live in communities, are often delivered in a neighboring community. So to put restrictions in place preventing people from traveling from community to community, that is not something we're considering right now.
Okay, thank you.
Operator, I do believe we've had all reporters, they've had an opportunity to ask questions, so we can take further questions. We have about 10 minutes.
Thank you. And the next question is from Peter Cowan from the CBC. Please go ahead.
I know privacy is obviously a concern, but are you able to give us any more details about the patient who was hospitalized in terms of a general age range, whether they have underlying medical conditions?
I'm not really able to give that information. I'm not privy to underlying medical conditions, actually, but apologies, but no.
Question from people in Labrador West are wondering why there aren't health officials meeting people at the border there when you have people driving into the province in the same way that it's happening in places like St. John's and Goose Bay.
Yeah, so what we put in place is very similar to what would be in place in the Straits area, in Bois Blanc, and in the Straits area in southern Labrador. Many people that would travel between the communities that would go there for medical services. There's families, connections in that area as well. So in the Lab West side with Wildbush and Labrador City, people do travel back and forth, work-related from a community like Fremont in Quebec as an example. So far, there's there's movement within those communities. However, I've heard some concerns coming out of Wabush and Labrador City, and tomorrow afternoon I'll be on a conference call with our members, our all-party committee as well. Have been invited to participate. And so what we'll be doing then is speaking to the community leaders, the mayors of those communities, and representatives, and we'll look and see what it is we can do to support them, if indeed we need anything there, but we think we might, and if so be it, we will work with those communities to put those necessary, services in place. It's important for us. If there's stresses and anxiety that's caused as related to the people in those areas moving from Quebec into Lab West, well, we'll work with the community to put in the appropriate measures.
Thank you.
Thank you. The next question is from Kellyanne Roberts from NTD News. Please go ahead.
Dr. Fitzgerald, are we worried about community spread at this point?
So at this point, it does appear that the cluster that we have, most of these cases right now that we can relate back to this one period of exposure at Call's Funeral Home. We have been doing screening with other, with our ILI testing or influenza-like illness testing. We are doing screening tests for COVID with all of those tests that are being done. We haven't to date found any COVID testing through that means, which would be an indicator of community spread. This technically is spread within the community at this point. However, we are able to relate that spread back to a single event. So it's not widespread in the community at this point.
Are we expanding testing, though? I know a lot of people reaching out saying, I have most of those symptoms that are listed, but I haven't traveled, and I don't know if I've been in contact with somebody who has tested positive. Should they be getting tested?
So if they get tested for ILI, they will get tested for COVID by default. It's certainly staying home is very important. Whether or not you get tested will not determine if you're going to spread this disease if you do have COVID. So staying home is the most important thing that you can do if you are feeling unwell. The information is certainly evolving. It's evolving rapidly with regard to who we should test and when we should test. We're having conversations about that on the national level several times a week. If the information and the evidence that we have suggests that we should expand that testing into a broader group of people, then we will do that. But at the moment, that's not where we are.
Kellyanne, it is actually worth noting that one of the challenges we have is this is cold season, and we are about, if not there already, entering another spike of influenza-like illnesses. We traditionally in this province do get a peak the end of March or the beginning of April. So all that sneezes is not COVID, but you need to be aware the best thing you can do for any of these kind of viral illnesses like that is to stay home if you're not well and to stay away from folk, practice good hand washing techniques, don't touch your face, and all the things that Dr. Fitzgerald said. So I think those are important messages regardless of the nuances of your question.
Yes, it's like we substitute flu season for spring here. I'm wondering, in terms of the early childhood educators, there's still a lot of them who say that they're now putting their health and their families at risk by having to go back to work, and they say they'll be cut off by government funding if they don't return to work. Premier, can you respond to this?
What we're asking is simply to support our essential workers. We have a large number of people that are interested in receiving childcare services, and this will allow them to go to work with the relief and relieve the stress on their children that would have appropriate childcare services. We pay those operators. We're paying them as if their spaces were full. And so what we're asking is to work together like we've seen in other examples within this province. And so if essential workers, they need to reduce the stress by having a childcare space available to them, well, we would support those workers. And if need be, we could expand that. Other provinces, by the way, are able to do this. I've talked to New Brunswick and Nova Scotia and PEI, many other provinces that are using something very similar than what we are proposing in Newfoundland and Labrador. So the risk of exposure to COVID-19 from a childhood educator, just as an example, these children would not be, they would not be the children of parents who are in isolation. These would not be the parents that, are impacted by COVID-19. These are the kids of parents that are working to supply services for everyday Newfoundlanders and Labradorians with existing healthcare issues. So to simply say that I can't be providing childcare services because I could be exposed to COVID-19, I just ask people, if we showed up at a hospital or an institution and the nursing staff said, I can't see you because you could expose me to COVID-19, or that paramedic who would expose you to COVID-19, that is not where we are as a society. All we're asking is to work together. We want to work with the childcare operators so we can free up some childcare spaces for those that need it. Now, ultimately, people, if you can get those services provided by a family or friends, that is always your first option. But when you don't have another option, we'd like to be able to free up some childcare spaces.
Thank you.
Thank you. The next question is from Holly Mackenzie-Sutter from the Canadian Press. Please go ahead.
Hi. We mentioned at the beginning that there's a lot of snowbirds returning to Newfoundland and Labrador, and quite a few of them from the United States, where they're seeing pretty big increase in cases right now. So are we tracking how many of the confirmed cases here are linked to travel specifically in the United States?
Yep, that is something that we are noting in any of our cases. Our travel history is fairly specific, so we will be tracking where people are coming from.
What we know in the United States right now, they are leading the world in with the impact and the number of positive cases of COVID-19. And so we know that Newfoundlanders and Labradorians, many of them will be coming from areas like Florida, where there's really no even state of emergency when these people would have left, many of them, just a few days ago. So we know, too, the level of prevalence in society in the U.S. as a general is about 2.5 times of what it is in Canada right now. So I think, it's best for all of us that when you get back home to Newfoundland and Labrador, is that you go in a 14-day self-isolation. That is mandatory. But that is not only to protect, those that travel, but it's to protect our whole communities. We see the impact of what happens with clusters and Call's Funeral Home. That is not something we want to duplicate in some of our communities within this province.
Thanks. And as a quick follow-up, you said the travel history is quite specific in the records that we're keeping, but would that information be made public, even just general, like how many cases linked to each country? I guess to help us understand kind of where this spread is coming from?
So it's not something that we're reporting routinely right now, but certainly as we get more information and as we do more analysis of that information, all of that will be something that we'll be reporting on, I'm sure.
Do we have any further questions?
Yes, the next question is from Peter Jackson from the Telegram. Please go ahead.
True or false, ibuprofen is not recommended for people who are suffering from COVID-19?
Undecided or not proven, I think, is the answer to that, Peter, on my reading of the literature. There are cases saying you shouldn't, and there are case reports saying it doesn't matter. So you pay your money and you take your choice at the moment. I don't know whether Dr. Fitzgerald's got this morning's latest trend off the presses.
No, I think that's still the thought with regard to ibuprofen. Acetaminophen, however, is still okay to use and works well for pain relief and fever.
Okay, and one other quick question. I just wanted to follow up with Kellyanne. That she said something about the daycares being afraid of losing their funding if they're not willing to offer care. Is that actually a problem?
What we want is to work with, our childhood with those operators. Right now, all we're asking is a very simple question: is can you work with us to devise a plan that we would pay you for 100% as if your spaces were all full? We're expecting to reduce the numbers, and to 50% or less, whatever it takes to make this work. We want to work with the early childhood education operators simply to provide childcare spaces for essential workers. Many communities and provinces have been able to do this in other areas, so it's just a simple call to action to support our essential workers. We know that this is not going away anytime soon. We certainly anticipate to be doing this for a few months, so we're just trying to support those essential workers that would require childcare services to support their families while they are dealing with the stressful situation within our healthcare system.
I'm sorry, was that a yes or a no, though?
What was the question about reducing the funding?
Because is it possible that they'll lose their funding if they don't help out with childcare?
Our objective here is to find a solution working with them. If indeed we got to take extra measures, we'll deal with that. But this is not, we don't want this to be an antagonistic, discussion. We want this to find a solution by working together, just like communities would in, as I've just mentioned, working with other community groups to support the trucking industry that are essential, some unsung heroes. All we're doing is, let's have that discussion, let's work out the details on this, let's support our essential workers. That could be, by the way, could be an early childhood educator who would need the services of those essential workers at some point in their life. Simply is not always going to be someone else. It could be an early childhood operator that would require the support of a healthcare worker, even in a COVID-19 situation. They are there to support us. Let's support them.
Thank you very much, Premier. The time for questions has ended. Thank you, everybody, for attending.
Thank you. The conference has now ended.